half of all women in their lifetime will have a fracture from low
Wow.
bone density. 1 in 4 men. So it's important to men, but it's really a critical issue for women. Something that you could use, early and, indefinitely, like Osteoboost, I think, can make an important difference. Gives you reminders, it guides you through the pressure check and calibration. It has a nutrition component so you can track your calcium intake. And then we last summer acquired an osteoporosis specific exercise program. And so we're working on integrating that in the app, but all Osteoboost customers get access to that program, which is also, showing very good clinical data.
Well, hey everybody, welcome into Pushing the Limits. Wonderful to have you with me today. Now I have Laura Yecies with me. Welcome to the show, Laura. Fantastic to have you. Really excited for you to share your wonderful wisdom with my audience today. So welcome, Laura. And yeah, tell us a little bit about yourself for starters, and how did you get here?
Sure. Thanks, Lisa. I'm super glad to be here on the show with you and love your work. Um, let's see. I am the CEO of Osteoboost Health. I had joined the company in August of 2020, and
Yeah.
I joined when um, we were in the middle of our pivotal trial. And my background is after business school, I worked in tech for
Mhm.
about 25 years. So, um, enterprise software, consumer internet. I ran the browser division at Netscape. I ran Yahoo
Wow.
Mail. Then I did two tech startups, both of which were acquired. My second one, Catch, I sold to Apple, and the Catch
Wow.
team went on to really become the leadership of the Apple Watch team. And, I just have always loved wearables. And after that acquisition, I saw this convergence of health care and technology happening and was super excited to move in that direction, which is what I've been doing for some time. And when I was connected to Osteoboost Health, uh, I was immediately super excited because I grew up in a family of doctors. Both of my parents, my siblings, my dad was medical director of a nursing home, so I worked there several summers. And
Mhm.
my grandmother had osteoporosis, and so really, deeply connected with the fact that this is a huge unmet need, a really important problem, and that there aren't great solutions. And my first thought was like, "Oh my god, if this product works, if this device works," and at the time, we didn't know, we didn't have the data. We had very good reason to believe it would work from some pilot studies. I was like, "This could have a big impact." And so I joined as CEO. I was the first, full-time employee,
Wow.
and um, we wrapped up, we went on to finish the pivotal trial, which took some time. And the data was very strong. And based on that data, we submitted in 2023 to the FDA. And then in January 24, got our FDA approval. And
Wow.
then
That's
now
amazing.
we're gearing up for launch. So that's kind of a summary.
Wow, you've had quite an incredible career. That's really, really fascinating. So, yeah, and I'm super excited about this because osteoporosis has touched my family too. Obviously, my mum has osteoporosis, and I'm probably at risk of it myself because being an ultra endurance athlete who had asthma and was on steroids the entire childhood, I know that I'm
Yeah.
likely to have problems, right, as I get older. So I've got one coming for mum especially, and I'm really, really excited to get this. And it's one of my pet passions is learning about how can we prevent and restore bone, when we're losing bone. And when I came across this, I was just so excited. So thank you to Dr. Elizabeth Youth, who's a wonderful physician in Boulder Longevity as well, for putting this on my radar, right?
Oh,
Um,
yeah. No, thanks, Dr. Yurth.
yeah, she's wonderful.
Spoken with her. Yeah, she's great.
She is absolutely fantastic, wonderful mentor and friend. So, so Osteo Boost belt. Can you tell us a little bit about? I mean, first, let's define what osteoporosis is and why it happens, and then walk us into how would this belt, so to speak,
Yeah,
help us.
sure. Okay, so we osteoporosis, osteopenia, chronic conditions tied to aging. Um, we typically achieve our peak bone mineral density in our early 30s.
Mm,
And after that, we tend to slowly lose bone. And then for women during the menopause transition, there's a period of, 5 to 7 years of typically highly accelerated bone loss and then further loss. Women have a lower peak bone mineral density on average than men, which is probably not surprising if you think of the physique of men and women.
mhm.
So women are more at risk of low bone density and fractures than men. Half of all women in their lifetime will have a fracture from low
Wow.
bone density,
Wow. Half.
and 1 in 4 men. So it's important to men, but it's really a critical issue for women. And then, why do we care about osteoporosis and osteopenia? Because of fractures. Hip fractures can be deadly.
Mhm.
Somewhere between 20 and
Absolutely.
30% of people don't survive a year. Half of hip fracture survivors lose independence. And then vertebral compression fractures, which are the most common osteoporotic fracture, 1.5 million per year in the US alone, are really very, very debilitating. There's not great treatments. And so really, that's what causes loss of height and kyphosis. And so the most important thing is to avoid um,
Yeah.
these fractures. And so you go from normal bone density. The first stage of bone loss is osteopenia, T score of -1 to -2.5. And then below that is osteoporosis. Now, in the US, there's 10 to 12 million people with osteoporosis, about 80% women.
Mhm.
And then, another 52 million people with osteopenia. So osteopenia is more common than osteoporosis, but for women, tends to progress to osteoporosis. The average American woman gets osteopenia in her late 50s.
Wow.
Now,
Mhm.
what's also, I think, important for people to realize is that osteopenia is not benign, right?
Mm,
Osteoporosis has a higher per capita fracture risk, but 52% of all fractures happen to patients with osteopenia. And, partly it's because there's just so many of them, but, also our predictive tools aren't perfect. And so you are in a bit of a danger zone with osteopenia of fracture and certainly in danger of progressing to osteoporosis. And so what we're really focused on is early intervention. So osteoporosis, what are the treatment options? There's a number of medications, both anabolic medications, anti-resorptive medications. They are not that well adopted, somewhere in the, 10% range of patients use them. In some cases, that's because of fear of side effects. In some cases, it's because the medications can only be used for a certain number of years. So
yes.
people have
Yeah, like your
to,
bisphosphonates and so on. Yeah,
yeah.
because they cause, yeah, other
But
problems.
then when we look at osteopenia, typically the bone remodeling medications are not prescribed, they're reserved for osteoporosis. So the standard of care for osteopenia in the past has been to tell women optimize your, nutrition, get weight bearing exercise. And for most older women, that typically looks like walking and Pilates and, things like that.
Mhm.
And that, unfortunately, is not enough to
No.
halt bone loss,
Mm, mm, mm.
right? And if you do high impact exercise, heavy duty weightlifting, that, can improve bone density. But many people or most people don't do that. And even those who do it are typically doing that a couple days a week. And
Mhm,
your bones need stimulation every day. And so our device was actually studied in postmenopausal women with osteopenia.
mhm.
And, you know, there, there are no FDA approved treatments that were specifically developed for osteopenia. And to me, this is such an important concept that we want to intervene early and prevent or slow or delay, but of course, hopefully prevent this descent into osteoporosis.
Yeah, and, getting FDA approval is quite a harrowing process. I was, like, amazed that you'd managed to achieve that. That's pretty
Yeah.
incredible. It's pretty hard to get through from what
Well,
I
let me
understand.
actually tell you a little bit more about that because we the type of FDA approval we got is a particularly challenging one to achieve.
Wow.
So we are a
Yep.
class 2 medical device. It's a prescription medical device. But the vast majority of class 2 FDA approvals are what's called 510Ks. So you're essentially comparing yourselves to a predicate or earlier device.
Mhm.
And but there were no earlier devices. There are no other
No.
medical devices approved to treat low bone density that are, prescription where you can claim effectiveness. And so that meant we had to go down this de novo pathway. And at the time of our approval in the history of the FDA, there had been only 14 de novo approvals versus
Amazing.
many, many hundreds of 510Ks. And so you really have to agree with the FDA on the standard, which, they tend to make that very, very tough. And
Mm.
then, of course, meet that standard. And so that was a lot of work on our part and, a big accomplishment. The key to getting that approval was the gold standard randomized controlled trial. So we did, a placebo controlled or sham controlled trial,
Mhm.
126 women at the University of Nebraska Medical Center
Mhm.
and postmenopausal women with osteopenia. And what we demonstrated with excellent statistical validity, statistical significance, is that we reduced the loss of bone by well over 80% in the lumbar
Mhm.
spine.
In the
And
lumbar
that's for
spine, that's
patients
really
who
hard to do. Yeah.
yeah, 3 times a week or more, and those results were assessed via CT scan. So patients had a CT scan at baseline and scan, excuse me, at 12 months. So highly objective endpoint.
Wow, I mean, I'm just take my hats off to you for getting through that process because you must be very, very determined to have achieved that, and it's so absolutely crucial, right? And when we talk about, osteoporosis is deadly. I want people to understand, like, this is not a benign thing that people think, oh, well, if I might break a bone at some point. And this can kill you. Like when my mum had a broken hip last year in January, or, the odds were that she would never walk again, especially with her very complicated medical history that she'd had and her age. She would probably die within the next year of complications, things like pneumonia that come up and all sorts of problems when you're sedentary and you're not moving and you're not rehabilitating, of course, you're losing your muscle mass, you're losing your condition. So I had to fight extremely hard, and you'll understand how hard I had to fight to get her back to walking again and then walking independently, which is even a year and a half out now, just managing to walk around the house on her own, without supervision. So it's been a long journey back, and that's with someone who's very, very dedicated
Mhm,
to bringing her back. So this is something that when if this happens to you, you can die from this. Like this is not, this is one of our biggest killers of our older ladies, especially, and. This starts already, Laura, in young ladies who are missing their periods, for example. This is
yeah,
a sign, for example, that your body is maybe impaired, or certain drugs. Like I was on asthma medications my entire childhood, and steroids and miles of steroids. Also did ultra marathon running. Now, exercise is good to a point, but not to probably the stupid degree that I did it, right? So athletic young ladies could be causing themselves
yeah.
problems as well.
Yeah, so, bones are very hormone sensitive. Very estrogen and testosterone sensitive. And we actually build, I think that, most of our bone mineral density, in the teenage years around puberty. And so, yeah, there are studies that show that um, girls who are athletic to the point where they lose their periods don't build as much bone during that period. Anything else that interferes with hormones during that period can be very, very devastating because you don't really get that time back. That's the time your body
Right.
has intended to build up your bone. And so if you miss that window, that's a challenge. Now, my belief in life is, woulda, coulda, shoulda. You got to look forward.
Yeah.
And so if maybe you didn't build as much bone because of one of those kinds of issues, or hey, half the population is below average, right? And even average still often gets osteoporosis. So if you're in your 30s or 40s and get your bone density measured and it's not great, well, then that's when you really want to work hard to preserve it. And probably that work, exercise using something like Osteoboost in the younger years could be even more effective. We saw in our clinical trial that the women in their 50s responded even better to the treatment than average. So, and I think this has been known with exercise as well. And so, yeah, it's never too late, but earlier is better.
Earlier is better for sure. And can you explain what the Osteo Boost belt is and looks like and functions? Like it's sending a frequency through the body, a vibrational frequency through the body?
Yeah. Um, okay, so let me just talk about vibration in general. So, um, why and how does vibration work to improve bone density? We know that bones respond to mechanical stimulation. So it's called Wolff's Law. They respond to stress and strain. So when you jump onto the hard ground, that puts force on the bones. And essentially, it's like you're sending vibrational frequency up up the skeleton. And there's been, for many years, research on vibration. Now, astronauts have particularly rapid bone loss in space, and NASA was very interested in finding ways to prevent or slow that. And so they funded a number of studies on using whole body vibration platforms
Mhm.
to improve bone density. And they saw very promising data. There are whole body platforms out there that talk about bone density, but none of them were able to demonstrate enough efficacy to get an FDA clearance.
Right.
And what we see with the whole body vibration platforms is, sometimes, compliance is difficult, but also vibration dissipates as it goes from the source. And so most of those platforms, they show their best results in kind of the ankles and lower
Right,
legs.
right, right.
And well, strong ankles is good,
Yep.
but the real issue is hips and lumbar spine. And
Mhm.
so our founder, the innovation was to take the vibration and apply it directly to the vulnerable anatomy. And then the other benefit that you get from our device is it's a wearable, so it makes it easier to comply. So you asked, what is the device like? It's a belt, a precision vibration belt. If you were to look at our website at the pictures, it looks a bit like a fanny pack. The
Mm,
vibration pack sits right on the sacrum, sort of at the bottom of the tailbone, and it sends vibration through the hips and lumbar spine. But there's some very important technology behind this because the key is not just to send vibration, but to be sure you get the precise vibration to the vulnerable anatomy. And so we have a pressure sensor to make sure there's good contact between the vibration and the body. And then we have accelerometers at the back, and there's an accelerometer that sits over the hip bone. And we're actually measuring the transmitted vibration. And you can think of it as a closed loop dosing system
mhm.
to make sure that we're getting that correct acceleration, the right amount of force and the right frequency to the skeleton.
Wow, wow.
And then
Mm.
we pair the device with a companion app, and the app connects over Bluetooth. It's not required, but it's very helpful because it sort of gives you reminders. It guides you through the pressure check and calibration. It has a nutrition component, so you can track your calcium intake. And then we last summer acquired an osteoporosis specific exercise program. And so we're working on integrating that in the app, but all Osteoboost customers get access to that program, which is also, showing very good clinical data on, balance and fall risk reduction, which is really important too.
Absolutely important. This is can you wear it when you're exercising or you're out walking, or is it, to be worn when you're sedentary, like when you're, standing or just sitting? Or is it,
Um,
all things?
so not sitting, you need to be upright.
Right? Okay.
Once you're in a treatment session, once calibration is done, you can walk, but
Mhm.
you wouldn't want to exercise in an aggressive way that would move the pack. Now,
Gotcha.
if you did and the pack gets out of position, it'll stop, you reset, so it's not like you'll do any harm. But, so I use mine when I walk. I use mine when I'm at my standing desk. Sometimes I'll
Mhm.
use it if I'm, in the kitchen chopping vegetables, but, like, not when I'm weightlifting or
Not at the gym,
do
things like that. Yeah. Yeah.
exactly.
Yeah, yeah. And so for people who are sedentary or even wheelchair bound, can they use it when they're in a wheelchair as well, or is that more difficult then?
We haven't studied that. It's probably not impossible, but we would need to do some work to make sure it works in that case because, when you're sitting, you're leaning back, it could dampen the vibration.
Yep.
So that's probably not an optimum.
Ideally, you'd be standing or just moving lightly around the house, doing your housework,
Yeah,
things like that.
which is, the important thing is we know what worked when we did the clinical trial, right? So we really want patients to do what we know works. If they're going to
Mhm.
invest their time, we want them to get the benefit. So
Yeah,
in the
yeah.
trial, patients, were told to be upright, that they could do these light activities, and it worked for them.
Yeah. No, that makes sense. And is there a like, can you overdo it? Like if you did it, like I tend to do everything too much, right? Just I'm an ultra marathoner. That's my mentality. Can you do this daily? Are you going to have a bigger response than if you do it, say, 2 times a week or 3 times a week?
We did see in the clinical trial that more frequent use, the people who used it 5 times a week had a better result than those who use it 3 times a week.
Right.
That result I shared, the 83 and 85% reduction in bone loss, that's for people who used it 3 times a week or more,
Mhm.
but definitely better result with more frequent use, as close to daily as possible.
Because
Now, the
yeah, the
last
bones need that.
limits
Mm.
your treatment to 30 minutes a day because,
Mhm.
that's within the OSHA safety limits, and also that's what was tested and found to be safe and effective.
Gotcha. That's yeah, so those are really good guidelines. And currently this is only available in the States. Now I'm lucky to work with docs in the States, so I've managed to get one for my mum. Do you have plans to go worldwide with this? Is there,
Absolutely. We
yeah,
have requests from patients all over the
I
world,
bet. I've
and,
I've already got a few of my clients who are lining up to
we're,
try to get one.
we're working on it, but, not quite yet. We've been focusing in the US, but we do have plans to bring this
Yeah,
overseas.
wonderful because it is so, so, so crucial. So if you're listening to this and you're in New Zealand or Australia, don't despair. There will be a path forward maybe, or perhaps you can work with a doctor in the States who may be able to organize this for you. Um, Laura, so is there anything else that we missed on the science perspective? Like, osteoporosis is a slowly degenerating thing. Exercise and weightlifting and within bounds and with good guidance, these are all things that you can do as well. Having a very good diet. Is there anything else that you would recommend people also think about in relation to bone from a natural perspective? With not touching so much on the drugs, but just on the natural side of things.
Yeah, so not smoking. I
Yep.
mean, probably if people are focused on longevity, they already
Yeah.
know that, but that's
Yeah.
um alcohol has been shown to, especially over 2 drinks a day, to not be good for your bones. Um, I've written an article about GLP-1s. There's some concern that people lose bone density. And not that those drugs aren't appropriate, but if you're on them, you need to be aware and really be working extra hard
Mm.
to
Doing your
maintain
training. Yeah. Mm.
that BMD.
Yep.
One thing we didn't talk about is we talked about early intervention, but we didn't talk about early testing.
Mhm.
And I think that is so important because, many people don't get DEXAs until they're in their 60s.
Yep.
And, it seems frankly pretty silly to me. It's a very safe test, less radiation than a dental x-ray. It's typically not that expensive. Um, and it just gives you important information, particularly, at the menopause transition. You want to see sort of your baseline, and then are you losing rapidly? So I think that,
That's some good
that's very
advice. Yep.
Yeah.
It's always good to have a baseline, even like with blood work and things like that, to have a baseline when you're healthy, say, and
Mhm.
then if you do it a few years later and test again and you can see the deterioration over, say, a 5-year period or something, then you're like, it's motivating too, because it's like, oh, I've actually got a problem. And these are things are silently happening in the background and we're getting on and we're busy in our day-to-day life. So it's a good reminder to
Yeah.
actually take action and be proactive in everything that you do, and that's what the show's about, obviously, is prevention. And prevention is really hard to sell because it's like selling insurance and you just didn't get something. But how do we prove that you didn't get something, you know? So it's always a bit of a tough conversation
Right.
with people.
And bone density, you don't feel any bone loss. So it's
No.
a particularly tricky one. But when I hear from patients, I hear that they've seen their mothers, their aunts, their grandmothers fracture. They
Mm.
know that they are at risk. And so even though they don't feel their bones and, it's a number on the DEXA, um, they are increasingly motivated. And I'm really pleased to see that, as the longevity conversation is evolving, there's more focus on strength and bone density because,
Yeah, yeah.
if you think about the quality of life in that last decade, oftentimes it's your musculoskeletal, health that drives, your quality of life. How active can you be? How independent can you be? Can you travel? Can you play with your grandchildren? That drives me. I have 6 grandchildren
Wow.
and, you know,
When did you
I want
start?
to
You
I
must have
started
started early.
young. Yeah,
Wow.
but, it's to me that's really motivating.
Yeah, and as someone who's lived with, with my mum who's had disabilities now for 10 years, after aneurysm, stroke, brain cancer, and hip fractures, and, you name it, she's had it. Um, the load on the family, the load on her, the degradation in the quality of her life. I can't pop her in a plane and take her to America to, do some of these wonderful things that I'd love to do, right? I can't do that. So I have to do whatever I can here to make sure that her quality of life is as good as I can possibly make it. But we did miss the boat. This happened before, I wasn't in
Right.
this space, so and it's definitely a coulda, woulda, shoulda situation, but it's better now than never, and she's still here, and I see life in a binary fashion. You're alive or you're dead, and if you're alive, then you can still do things and make your life better. You might not get it back to a 30-year-old you, but you can make it better.
Yeah. One other thing with bones that I think is worth thinking about is, let's say you are not anti-medication. There are many people who are in the bone world, but let's say that's not the case. We just came back from the Bone Health and Osteoporosis Foundation conference in DC, and one of the gurus is Dr. McClung at Portland, showed that if you use the most potent osteoporosis medications over 10 years, you get maybe about a 10% improvement in hip bone density.
Mm, wow.
So, and that corresponds to about a half a T score, like -3 to -2.5, roughly speaking. Now, that's
Wow.
average. Many people get better results, but then some people get less. So, you can't really take an attitude that, well, I'm not going to pay attention to it. And then when it
I'll
gets
just
bad,
take the drugs.
I'll
Yeah,
take the
and that
drugs because
yeah.
those drugs, they are very important and they're very useful, but they're not a cure.
No, they're definitely
Not
not.
a cure. So you want to not count on the drugs for this much. You might need them for this much, and you want to lessen the need and delay because we don't have a drug that can totally reduce your fracture risk. And
No.
10% is, you get more than 10% fracture risk reduction, but there's still a lot of fractures out there. And then
And there
people have,
is atypical fractures and osteonecrosis of the jaw and things that, can also be risk factors. And, you've got the increase in the bone turnover, the bone osteoblasts, but
right.
the quality of the bone is less with some of these drugs as well.
Yeah, well, and especially if you take them for a long period of time, those side effects accelerate. But anyhow, I think to me, the takeaway from seeing that data is we need multiple tools in the arsenal.
Yes,
And,
yes.
the lifestyle that we talked about, but something that you could use, early and, indefinitely, like Osteoboost, I think, can make an important difference.
Absolutely, and there's no downside to it at all, you know?
Absolutely not. Yeah.
For
No
me, it's like a
serious
no-brainer. Yeah.
yeah, no serious adverse effects in the trial.
No. No, this is absolutely wonderful. I do hope you get it out to the entire world so that everybody can benefit, and
Working on it. We're
yeah,
working
yeah.
on
If I can help you get it down here in New Zealand, then please do reach out when it comes time, or New Zealand, Australia, because this is we've got lots of people down here needing it too. So,
it.
and this show goes out to a lot of American listeners. So, if you are in America and you do want to get one of these devices, how does somebody go about it? You're in pre-release at the moment. I know that I'm.
Oh, actually, we've officially launched, so you go to
Mhm.
osteoboost.com and order, and you need a prescription. You can get it either from your personal physician or we have an easy telehealth option. So, both
Wonderful.
are available. And, yeah, we're, really appreciate the opportunity to share what we're building and to get the word out.
It's absolutely crucial. Thank you so much for sharing this. Thank you so much for making such a wonderful device available to the world, and doing the deep research that's required, and going through the FDA and all of that, because that's what we need, brave people who are, willing to take on massive challenges so that we can get these things through. So thank you so much. It's been
My
wonderful.
pleasure.